Patients who don't need emergency care are being encouraged to visit their GPs, but that is putting greater demands on family doctors at a time when their numbers are falling. Our health correspondent Dominic Hughes has the story.
Good morning, Hall Green Health. Sarah speaking, how may I help you?
It's Dr Ashraf calling from Hall Green Health.
The start of another busy day for Dr Sonia Ashraf.
Ring the first patient and just get their consent.
Today, on the phone or face-to-face,
So this was the higher dose one? Yes?
she'll talk to dozens of patients.
How long have you been feeling like this for?
It's a big operation, home to more than 20 GPs, as well as nurses, physios and pharmacists, contacted by around 1,000 patients every day.
What's this about going homeless? What's happening there?
This surgery will see more patients in a day than the local
You
A&E.
mentioned it on your rings.
But compared to hospitals, GPs work on a much more limited budget.
Come straight through. The amount of investment put into general practice is still just not enough. We then have to start thinking of ideas for smarter working.
I can't guarantee the time, but you're ready far on the list.
Can I take a date of birth?
And this is what smarter working looks like. Making sure enough call handlers are working when the lines are busiest.
Any time between 8:30 and 6:30 the phones are live, and there's not many periods throughout the day that it goes quiet enough for them to be able to do anything else.
Data around call numbers, test results, prescriptions, all the complex tasks of a modern surgery are analysed to save time and money. That also means rethinking who does what. So the majority of patient house calls are now carried out by paramedics like Sophie.
By allowing us to see the more acute minor injury and illness patients, that saves the time for the GPs to see the more complex chronic problems.
Meanwhile, back at the surgery, Dr Nashat Kamar is running the busy afternoon clinic.
Take a deep breath in.
Each consultation requiring a quick and accurate medical judgment in a system under pressure.
This is the sort of area where it's hurting, yeah? We are getting a lot of work being pushed through to us by hospitals. And they're asking us to do a lot of the work that they used to do. And certainly the administrative side of things over the last 5 years has significantly increased.
Managing that increased workload has changed the relationship between patients and family doctors, with a greater emphasis on help that's available across the community.
We have evidence to show 1/3 of contacts made into general practice could have actually been dealt safely elsewhere.
The same pressures that are driving change here are seen too in Scotland, Wales and Northern Ireland. So as this little patient grows up, the transformation of GP surgeries across the UK looks set to continue. Dominic Hughes, BBC News, Birmingham.